This is the podcast where we go deeper than data to talk about leadership, impact, and what it really takes to move healthcare forward. I'm your host, Stephanie Dorwart, and today's conversation is going to be about something that every healthcare leader is focused on, retention, but very few actually realize and understand what that means. We're also going to talk about patient leakage and competitive pressure. Most healthcare systems today are making decisions using data that is months old. Patient leakage is discovered after the budgets are submitted. Turnover, it's only analyzed after the exits happen. And strategies they're becoming reactive instead of anticipation. This changes with PrognostiCare, a company that's giving leaders near real-time visibility into patient movement and market share shifts, as well as turnover data that's necessary. Finding out who is leaving, where the patients are going, and why. Staff retention using Moneyball-style metrics to predict who is likely to leave before they walk out the door. Joining me today are two of the leaders behind this innovation. Todd Birch, CEO, former healthcare executive who saw the cost of delayed data firsthand, and Robin Bradbury, CFO, a financial strategist really focused on turning intelligence into ROI, retention, and margin improvement. Before we get started, I'm going to allow both of them to share a little bit about their background, what they're passionate about in healthcare today, and allow you to get a little bit more in depth with their background information of what brought them to PrognostiCare. Todd, why don't you start and share what you're passionate about and what we're here to talk about today?
Thanks, Stephanie. Appreciate it. Thanks for having us on the podcast. Excited to share what we've got going on with PrognostiCare, kind of how we got started and kind of what it's doing for health systems across the country today. So just as a quick background, I started my career about 20 plus years ago as a hospital CEO in a small critical access hospital. So I'll let Robin introduce himself.
Thanks, Todd. Robin Bradbury. Appreciate the opportunity. I am a CPA, Deloitte trained, and spent 8 years there at Deloitte in Denver, Colorado. After my stint at Deloitte, I was a fractional CFO for several companies, some healthcare, some otherwise. And as I transitioned into that role for the next 15 years, I saw one of my companies was a revenue cycle company in the healthcare space. And as I began to look at that space and realize that this was an opportunity, I created a company called Resolution. So looking forward to the discussion today.
Thank you both. It's a pleasure to be here today. And I know working with several hospitals throughout the country, both of these topics are front of mind with all executives, especially in terms of thinking through the patient leakage and in terms of the patient population. But more importantly, today, we're hearing more and more about retention of staff. And, I think that's one of the things that really has inspired PrognostiCare. Robin, you touched upon it. Todd, I heard you mention it as well. But I'd like to dive a little bit deeper about the employee part of this and, really what inspired you to create the retention and turnover platform and the work that you're doing. And I know that you talk a lot about, some of the scores and quantitative metrics that we'll get into later. But what really led to the creation of the current tool?
Yeah, thanks for asking, Stephanie. So the creation of the current tool, which is PrognostiCare Staff Retention, really was born out of all of healthcare suffering with not having enough staff, not having people in the jobs that you need them, chronic open positions that really detract from an organization, continuing to be able to provide a high level of care. And that turnover is just so disruptive, not only from an economic perspective, which we'll get into that in a little while, but just from a culture perspective. When you have a revolving door of people in certain positions, it's hard for a department or a division or even a building to develop a sustainable culture that really puts the patients first. And so being able to know when people are having trouble, when they're struggling, whether that is at work or in their private life, being able to give the frontline managers that tool to be able to show them this is a good time that you may want to think about having a conversation with Jill, that she's having some troubles right now. And if you don't do something, Jill's going to be moving out the door and you're going to be replacing her. And so you may or may not be able to keep her, but knowing when it is the right moment to have that conversation and being able to give those frontline managers that tool is just something that doesn't exist today, right? So we all do rounding, we all other things to engage our team as best as we possibly can, but you only learn so much through that. And what PrognostiCare staff retention tool does is it really paints the picture of the whole person, and it really draws out all of the things that are going on, not just in their work life, but in their private life, and puts that into kind of 4 categories. And so those 4 categories are what's going on from an economic perspective. So from money, benefits, what's going on from a schedule, what's going on in their work-life balance, and then what's going on with their family. And we've got the tool functioning at a very high level right now. We're able to predict at a very, very high um, confidence level when somebody is going to be at risk of leaving. Clearly, we can't 100% of the time get to that point, but we're at a very, very high rate right now with being able to know. We've been able to backwards test that to see if our prediction held consistent with what actually played out over a period of a long time.
Yeah, it's absolutely fascinating and so important. I always talk about the fact that turnover is one of those numbers that never hits the balance sheet. We know the statistics throughout the industry. We can talk about the fact that every time you lose a nurse or you lose a clinical person, it's anywhere between $50,000 and sometimes upwards of $200,000 to replace that position. But those numbers never hit the balance sheet or the operating margin visibly. And it's an area of opportunity. I believe this tool solves part of that problem, especially on the retention piece. But I do want to touch upon the fact that it can also support organizations prior to the hire. Is that accurate and correct?
That is. So what we've seen is so much of turnover happens just right after the person gets into the organization. In fact, about 44% of all first year turnover happens within the first 90 days. And that's really problematic because that means we didn't make the right hiring decision. And, frontline managers have those struggles where sometimes you just need somebody to be in a position, even if you know that they're not going to stick with you for the long term. But when those things happen, we need to be more cognizant of, okay, we know this person is a short timer with us. They're not here for the long run. And in that situation, let's be smarter with our training dollars. Instead of training everybody at the highest level from the moment they walk in the door, if they have a higher risk of departure and we think they're not going to be with us for more than 90 or 120 days, let's just spend the minimum that we need to get them up to speed to be able to do that job. Let's not get them trained like they're going to be here for the next 2 or 3 years. Let's put those dollars towards the people that are going to be here for the long term. And then you just get a cumulative impact of putting your training dollars into practice and effect more usefully so that the people that are with you are getting smarter faster and getting to be more productive.
Yeah, I love that statistic and that information. One of the things that I think we often fail to realize is that when a person, departs the organization, it's going to take a new hire 18 months, sometimes even longer that to just get up to the proficient, expert level. And they may never get to 100% of the person that left's, output or productivity, if you will, or even area of expertise. And this tool can help make sure that those individuals that you're going to invest in the hire first off are going to stay with the organization. But more importantly, help you understand where those training dollars go. So I think that's a great link to really tie the education dollars into with what PrognostiCare can do. And Robin, I know you sat in that CFO position in many different organizations and then supported the revenue cycle teams of hospitals. And then you had the experience after, Resolution moved into, its company following that. But what would this tool have meant to, your clients, to your hospital organizations, to all this? What kind of difference would that have made?
Well, I'll tell you, we were in a very unique position of going into a hospital and evaluating their staff, and on the business office side, but the parallels are still the same between the medical side and the business office side. You've got people in there that are maybe not happy with what they're doing. They're not performing at their top level. And I guess the best way for me to describe this, and I'll do this in a kind of a funny way, I would go in, I'm a CPA by training. It's all about the numbers. I would go in there and I would just tell everybody, you've got to get this AR down. You've got to get more cash in. You've got to touch more accounts. And, I'd go all into all the mechanics of what they needed to do. And as I brought them to tears in that situation, Then my wife, who was the partner in my business, would come in. How's your family doing? How's your kids doing? How are your, how is everything going with travel? How are you feeling about things? And this is exactly what PrognostiCare is now doing. So my wife was PrognostiCare in the flesh, and she was getting that information. And I had people that were literally on the road for me for 20 years, going out for 3 weeks, coming back for a weekend. And they were doing that for 15 to 20 years. Now, they're not going to do that if I'm sitting there hammering them on AR, cash, time, how many accounts did they touch, et cetera. It's not going to make the difference at all. But when there's that personal touch, when you begin to get a glimpse of what that person's life is truly all about, what's happening in their life, and again, this is not as personal as Nancy going in there and having those conversations, but it's similar in that you're finding something out that you can address.
As we shared this with one executive, Stephanie, he kind of boiled it down very succinctly what Robin just said. PrognostiCare, executives are really good at judging talent. Sometimes we miss, sometimes, but we're pretty good at judging talent and getting people in the right seat. But as you go down the ladder, those skills become a little less firm, and the frontline managers aren't always necessarily the best at choosing the right cultural fit for the department. But he described it really well. He goes, PrognostiCare takes what I know qualitatively and makes it quantitative, which is just a great way to sum it up, because when you're talking to somebody if they're going to be a good fit. If they're going to be able to do a decent job. You don't always know whether they're going to stick with you or not, but whether they're generally going to fit with the team. And what this does is it takes that kind of executive level insight into, are we going to be able to keep this person? And it makes it so everybody can use that tool, and everybody has that kind of higher level insight into what's going on. So you can use it from a pre-employment perspective, use it while you have your teams, to be able to know when those key points of engagement need to be and how you need to engage with them.
And I think hearing both of you speak about what PrognostiCare can do, and hearing you speak about, that particular executive's perspective, Todd, made me think about, another very relevant utilization of it from a system level perspective is, PrognostiCare really identifies where the organization's falling on the spectrum when you look at employee engagement scores and employee satisfaction scores when you link it in retention, without necessarily doing that employee engagement survey. But more importantly, we're always talking with clients in HR about A-level players, B-level players, C-level players. And I think this quantitatively gives the organization a perspective of what percent of your employees are C-level employees, what percent of them are B, what percent of A, because there's a direct correlation and link to performance with those retention scores. And you identify, who has that risk of leaving. But I love the talk and the fact that you can take this and really understand who you should invest in. And Robin, I heard you, mention and talk about that we do a great job of identifying strong leaders, but then we don't necessarily always do a good job of investing in those leaders. And I think PrognostiCare can give a little bit of a lens into what that should look like. I'd like to transition a little bit and talk about the other side of the business quickly. You also have another solution that really focuses on the patient leaving and mitigating the risk of the patients that are leaving the system. Todd, can you talk about that other solution that you've had in the pipeline a little bit longer and what the impact of that is?
Yeah, so the other component is our market share tool. And there's kind of two things that the market share tool does. In healthcare right now, market share is based almost entirely upon claims-based information, which is great. It's gold standard. You know exactly where patients are going to, as long as they're in a hospital. If they're in the outpatient setting, the data gets a little weaker, but you still have pretty good visibility into what's happening. The issue is just the time that it is delayed in getting there. Now, right now, everybody's on equal footing. Well, at least everybody except our clients are in equal footing in that they're getting the same information roughly 6 months after it becomes available, maybe a little shorter, in some cases a little bit longer. But 6 months is a long time in today's world. 10 years ago, 6 months ago, or 6 months old data was not a big deal. But in today's world, where information passed 2 or 3 days ago is ancient, it's just a very different world. And so what we figured out how to do is how to track market share in real time. And so instead of having to wait for those claims to come through and see what happened 6 months ago, we can see where people were today, and we can kind of supplement. It doesn't replace claims-based data, but it supplements that claims-based data to give you a more real-time look at what's happening in the market, what's moving people today versus what moved people 6 months ago. Because I may not remember what was going on 6 months ago, and then trying to explain to the executive team or to a board about, well, we think we did this and we think we did that. Well, we just don't know is the true answer. But I, as many others, have been in those meetings repeatedly, trying to remember what you did previously and whether your market share moved up or down.
And that's where I think the power of this tool is.
Yeah, I think there are a lot of applications of the tool when you think about the power of having that information timely and an accurate perspective to understand that, especially when you look at the rate that organizations are hiring providers and the turnover in some of those areas. And there's a lot of cost that's played into both the providers, the APs that might be there, but also the staff that's supporting them. And being able to predict that a lot better and dive into it timely and accurately makes such a big difference. And I can really see a huge triangulation, if you will, between the patient care utilization data, the information that you're pulling in for retention and turnover, and the your actual employee population, and then what Altius does with the productivity. And the three of those together, I think, almost lend itself to really being a trifecta of quantitative information that can drive strategic decisions moving forward in a way that gives organization a lot of accuracy around the money ball of the statistics. I know one of the reasons that we're here today is because of a white paper that was shared with me on PrognostiCare and the Moneyball, and it captivated me so much today that I just had to share, the solution with the audience. And I want to talk about that Moneyball perspective because it really does bring that quantitative piece into play. And I think it has a lot to do with something that you refer to, I think, as the NPS, and it's the Net Promoter Score. So I wanted to talk about that a little bit and the proximity of that data, and then how that Moneyball application really is a perfect analogy to what you're doing for hospitals on both the patient claims data side and on the retention side. So Todd, if you want to talk about the origin of that Moneyball reference, that would be great.
Yeah, I'm glad you brought that up, Stephanie. So the Moneyball reference is the movie, of course, starring Brad Pitt, but based on the early 2000 Oakland Athletics. Hopefully everyone's seen the movie. If not, go out and watch it. It's a great movie. But what they did was they had to replace three superstars that had left the team, and instead of going out and finding three other stars to be able to replace them, they started looking at the math, they started looking at the metrics, and they started to uncover hidden value among people that were maybe not the superstar name, but just had great production. And that's really kind of what staff retention does, is it starts to pull out who are those people that are likely to stick with us, who fits that category of being that perfect player that's going to go play shortstop for us, and they're going to fill that perfect gap as shortstop. You talked earlier about the novice to expert curve. We absolutely agree with that. We kind of break it down into four categories. So novice is kind of that first 9 months you're with the organization. Becoming an advanced beginner is the second 9 months, getting you up to that 18-month category. Becoming proficient after 18 months, and then moving into being an expert. We want everybody to be moving into that proficient and expert category, because that's how we get more productive people. That's how the organization has better results. And so being able to know what's driving people underneath and say, okay, this nurse in this particular job group is likely to have a risk category that's going to spike at month 23. Okay, at month 22, that manager needs to be helping that nurse through month 23. We got to get her through month 23. We get her through that, and we're going to be at a good place. When we're hiring people, knowing that if we hire somebody that is less than 27 miles from the hospital or from their work location, they're more likely to stick with us. That's really key. If all things else are equal in the hiring process, I want to hire somebody that's in that sweet spot that is most likely to stick with us. If we can tip the scales just a little bit, right? If we can have somebody that is, 14% higher likelihood of staying, that is a meaningful number. And if there's nothing else delineating the two candidates, let's pick the one that's going to stick with us.
Yeah, I mean, whenever I'm thinking through the potential of having that information as a leader, you're really envisioning a future where you have line of sight to the potential for someone to depart before it even happens. Who's likely to resign, why, and then being able to figure out what you can do to retain them. And if you can just make that shift and change as an organization, to your point, it's powerful. We've been talking a lot about the anatomy of a target, as it relates to productivity and what's beneath the number, what's beneath your hour per workload unit. And there are times where we'll have HR departments that are operating below median. Maybe they're in the bottom 10, 15% of their comparative information. And 99% of the time, if that HR department is in the bottom 10% of comparatives, they also have high turnover, poor retention, and some of those same statistics because it's all aligned. If all you're doing is churning employees and hiring and losing, it all plays together. So you're not just sharing and showing the data at PrognostiCare, you're really helping the leader see ahead to the future, not just looking back in the rearview mirror, and you're sort of redefining what it means to go beyond the benchmarks, what it means to go beyond the analysis, beyond the numbers, and give a lot more detail, into all of the information there with that predictive, retention information.
Yeah, absolutely. I'm glad you brought up the accuracy because there's kind of two sides of that house. On the staff retention side, being able to get down to that level of accuracy helps you pinpoint what action to take with which individual employee at the right moment to be able to retain them. We spend so much money on our teams. You want to be able to keep them and keep them productive working at the organization. On the other side, on the market share, that accuracy for one of our clients really changed the paradigm for them. They just knew they're in a very, very large market, very competitive market in a metro area, lots of different health systems competing. And they just knew that there was this one other health system that was eating their lunch, and they were focused all of their strategies on this one health system. And when we looked at the data using PrognostiCare, found out that wasn't their problem. There were two other health systems that were really their problem, one of which they considered to be a friendly organization towards them. And so it was paradigm shifting for that particular organization to be able to get beyond, just the benchmarks, beyond the numbers, beyond even their perception of what reality was, and to be able to see, okay, here's the real problem, and let's go deal with the real problem, because that informs capital strategy, that informs recruiting strategy. And if you're fighting the wrong problem, you're deploying your resources in the wrong area, then you're not fighting the right fight.
Absolutely. If you're putting out the wrong fire, you're never going to make any progress.
Mm-hmm.
A couple quick stories there. Todd, you told me this story that you had visited with a hospital who indicated that their star employee was this individual over here. And part of our strategy is go out and look at social media and look at what that person is saying about the facility. Well, they were just trashing the facility, absolutely trashing, and yet in their minds, this was their star employee. So how do you reconcile those two? The other example I remember from this goes a little ways back. You'll understand when I tell you who the players were. It's a small hospital in rural Texas, and what they you look back into the business office, and those people were on the phone all day long. They were just making calls like there was no tomorrow. And what we found out is we put somebody in there just to kind of listen to what was going on, and they were collecting claims and putting out bills and coding things, etc. What we found out is they had a great Amway business going on back there in the business office, and that was they were busy, they were productive, they were really doing a great job, just wasn't to the benefit of the hospital. And so those kinds of, you can, with the ability we have now to have insight. I mean, how many times have we seen people be fired from a school district because they posted something negative about what is happening in the world right now. And so the social media has a huge impact on determining the health of an organization. And if you don't use it, it will overwhelm you.
Robin, from the perspective of the CFO, one of the things I'm sure that you're asked is, what's the return on investment for PrognostiCare, either as it deals to the patient claims data or as it deals to retention? And what would you tell someone if, they're coming to you and saying, well, how can I recapture my ROI on this? What's it going to do for us?
That's a great question, and I'm not sure we have the answer yet. We're early on in this, and we're finding that there's a lot of interest. And what I'm really hearing out there, and Todd, you can chime in here, but what we're really hearing is, boy, we know this is great information, and we need to do it. And if we don't do it, our competitors are going to do it. And we believe that it's that starting point of getting someone involved. I mean, the amount of money that's spent on surveys, for instance, Press Ganey or whoever is out there doing it is enormous. And there's, the return on that is suspect at best. And so what I think we have to measure to get a return on investment is, what's your turnover? Has it decreased? What's your market share? And you can literally look at every block of patients that you have. So if you've got a block of patients from 3 years ago, are they still coming to you, or are they going out to competitor facilities? Same thing you can do another 6 months later, 3 months later. Where are those patients going? And you start to see that decrease. That's going to result in top line revenue and bottom line improvement. There's no question about that. So it's a little bit of a cart before the horse. But we believe very strongly that if you make the investment, which is minimal in the grand scheme of things, you can see some returns very quickly.
Yeah, I would say, and add to that a little bit, that not only do I suspect that executives, health organizations are going to see returns very quickly, but the more important thing to realize is, what's the financial cost of doing nothing?
Yes.
What's the financial cost of not knowing this information? What's the financial cost of not identifying, the individuals that have a high likelihood of leaving the organization? Are you actually training people and putting a lot of resources into individuals that are probably walking out the door in the near future? And, what could be the benefit to recognizing that and stepping in and retaining them? And I think that's the powerful thing, is what's the financial cost of doing nothing? But I want to ask, both of you one final question, because you are helping leaders see ahead, not just looking back. You're sort of redefining the data that's available on retention and entering into a market, quite honestly, for data that's been untapped. I don't know anyone else that's, pulling information in this way and providing it back. And I find it so valuable. So I just want to ask one question of, what does this mean to organizations to go beyond the benchmarks and actually access this information and have it at their fingertips? And what do you think the impact could be on a hospital healthcare system if they were to put PrognostiCare in place tomorrow?
Yeah, that's
What
a
does
great
it mean to
question.
their future?
Yeah, what does it mean to, as I spent 20 years running hospitals, I always said that hospitals and healthcare was 20 plus years behind every other industry. So we just had to look and see what everyone else was doing and emulate that, and we could look like we were really smart. I would say right now, this is an opportunity to not be 20 years behind. This is an opportunity to be ahead. And we're actually having conversations about the staff retention beyond healthcare, with manufacturers, with some other industries, because retaining people is important in every industry. And so if you can move, historically, we've been using lagging metrics. And then we started using leading metrics, which were sort of indicative of what we expected to happen. This is really moving to predictive metrics. And so moving from a lagging state where we were behind other industries to now being able to move into a predictive, ahead of where other industries are at. I mean, that's really game changing. And I think as we have artificial intelligence coming in to help supplement the way that different careers are done, it's going to push some people back into healthcare, because you're not going to automate a nurse. You're not going to automate a technician. You're going to supplement them. And so over the course of the next 5 years or so, I think we're going to see more people coming into healthcare than we have had over the course of the prior 5 years as people have been exiting healthcare. And that's going to give us an opportunity and really to be able to build the teams and build the culture and look for those key players to fill those key roles that we want to be on the team that are going to be accretive to the organization, accretive to the culture, and building a high quality enterprise across all of the footprint.
Great. Robin, what would your response be?
Well, I love the indication towards artificial intelligence, because AI in its simple form is simply going out and looking at all data sources, collecting them together, and giving you the best answer. That's essentially what AI does. And so if you're only looking at a portion of that data, which is historical performance, historical information, you're not looking at what's out there on social media. You're not looking at what's out there in the other areas that we look at, the geofencing that we do in some of the areas. You're not really seeing the whole picture. So you're getting an incomplete answer to what you're looking at. And yes, you're getting an answer, and you feel really good about the fact that you've got an answer because, well, all of this data supports it. Well, if you're only using 50% of the data that's out there, you're not really getting an answer that works. And that really is what AI is. At the end of the day, it's simply looking at every other thing that's out there and culling it together into a place that somebody can actually use that data to make better decisions. And I think that's what we're really doing at the end of the day.
It's definitely powerful to have all of the data instead of 50% of it. And at the end of the day, as you mentioned, being able to use that to really predict and determine the future for the healthcare organization has many, many valuable, I'd say, applications. And it does wonders for growth strategy. It does wonders for strategic planning. It does great for staffing predictions, all kinds of things that allow you to go beyond the benchmarks and improve the organization and the culture. This has been a fabulous conversation. Todd, Robin, if individual hospitals want to find out more about PrognostiCare, where should they go, and how should they reach out and contact you?
Yeah, absolutely. So they can go at our website, www.prognosticare.org. And from there, they can make contact with us. Certainly, they can connect with us on LinkedIn as well. I love to have conversations with them and point them towards our business development team.
Excellent. We will drop all of the key contact information in the show notes as well. And thank you for your time, your insight today. It's been a pleasure hosting both of you on Beyond the Benchmarks. To our listeners, thank you for joining another episode of Beyond the Benchmarks. If this conversation sparked something or challenged you how to think, please share this with someone else that can find value in it. Share it with a colleague, subscribe, and definitely stay tuned for more conversations reshaping healthcare.